right, okay. So can everybody hear me okay? Yeah, okay. So hi everybody, my practicum was at the CRD, and for some of you out-of-towners, maybe for some of us in-towners too, the CRD can maybe be a little bit mysterious at times, but it's a federation of 13 municipalities and 3 electoral areas on southern Vancouver Island. I was also very fortunate to share an office with Shannon Clark, who you'll get to hear from next. So initially I approached the CRD after learning that they were transitioning from a regional growth strategy to a regional sustainability strategy, and I wondered if this might be an opportunity to apply health in all policies or maybe health equity impact assessment. But as it turned out, the opportunity that was available to me was related to the CRD's Community Health and Wellbeing Research and Policy Project, which was actually very exciting. And more specifically, I was able to work on something called the Regional Outcomes Monitoring Project, which brought together a number of organizations across the region, including Island Health, the United Way, the Community Social Planning Council, the Victoria Foundation, Success by 6, and others, as a means of trying to better understand what sort of community health and wellbeing outcomes are these organizations monitoring, and to develop a collaborative process for monitoring community health and wellbeing. So the question for me became, if we're going to be monitoring community health and wellbeing, then what are the things that we need to be measuring and why? And so the purpose of my project was really to produce a body of literature that would support the selection and development of community indicators. So there are 2 main parts to my project. On the left, you'll see there is more of a theoretical foundation in the literature synthesis. And then on the right, there was a more real-world component, so a jurisdictional review. And I used Google to search for community indicator projects across Canada and abroad, really just trying to find any community indicator projects with pearls of wisdom we could extract that might be relevant to the CRD context. So I'll just present here some of the highlights of my results. I've got indicator frameworks here because indicator frameworks I found were really helpful for figuring out how to organize the indicators and decide what sort of indicators we needed to include. And I've got health on the left, well-being on the right, because although health and well-being are obviously very much interrelated, they are still distinct concepts, so we had separate frameworks for each of these. Now for community health, we looked at 3 conceptual frameworks. And although each was unique, for the most part, there were some commonalities. For example, they all tended to recommend that you include indicators for determinants of health, for health outcomes, and also for how health and its determinants are distributed, which is no shocker, I think, to us MPHers. And then for community well-being, we drew from the Canadian Index of Wellbeing, which had 8 domain areas, 64 indicators. I've got 3 of the domains up there. And something that I found interesting was that the Index of Wellbeing doesn't actually include measures for things like happiness or life satisfaction. The reason being, they pull their data from Statistics Canada, who don't routinely collect that information themselves. So that was one of the more interesting gaps that I noticed. And then in terms of the jurisdictional review, I was looking for projects whose selection of indicators was evidence-informed, projects that incorporated evaluation, also projects that were intersectoral partnerships with some sort of identified strategy. We found about 50 or so projects and whittled it down to 9. Thank you, Marika. And what we found was that there was a real variety of conceptual approaches to community indicator projects. So this slide has turned out terribly. These are all different colors. It's sort of a Vennish type diagram anyway. Sustainability is on the left there. That was one of the more common types of indicator projects we found. Healthy cities and quality of life, a little bit less so. Some of them aligned with other strategies. They didn't necessarily have their own conceptual approach, but maybe they aligned with, for example, a provincial poverty reduction strategy. But really we felt that health and well-being were at the center of all of these projects in their broadest definitions. There's quite a lot of overlap in these sorts of projects. And then also just important to note that most of these projects did have some degree of community input. Some of them were very bottom up, and community engagement was seen as really critical to the success of the project. Others were, almost totally top down. Most were somewhere in between. So I've got Understanding Glasgow, and again, another very poor slide here. It's just a screenshot from the website of one of the projects that I reviewed. And I just wanted to include it here because I thought it did a really great job at highlighting health inequities, which some of the other projects didn't necessarily do so well. So this project was led by the Glasgow Centre for Population Health with help from Glasgow City Council, the National Health Service, and a couple other community agencies. And that sort of intersectoral partnership is very typical of these sorts of community indicator projects. You often will see one or two levels of government. You'll see someone from health. In Canada, you'd sometimes see Ministry of Health representation. You would see sometimes universities, even school boards, businesses, community nonprofits. So a real diverse health and non-sector partnership is quite common. But back to this, Understanding Glasgow has 12 domain areas, and those are just the circles, the colored circles around on the right-hand side there. It has a number of indicators under each domain area, and it also has a suite of children's indicators, which was very unique across the projects that I found. So the health inequities that they highlight are based on gender, race, disability, income, and geographic location, depending on which indicator you're looking at. And I just thought it really did a great job at being an accessible resource, and it sort of describes it a bit on the left there, but it's described as being an accessible resource to inform Glaswegians about the issues of importance in their city, and it's also meant to be a tool to help monitor progress and encourage discussion about the city's future. So just one of the more interesting projects I came across, although it was more top-down than some of the other projects, which I found slightly interesting. And then in terms of methodology, if the ultimate goal, when these organizations want to monitor community health and well-being, if their ultimate goal is to improve population health and reduce inequities, then it's really important that the data can be broken down and compared by population groups so that you can compare the most advantaged and the least advantaged populations. And depending on the source of data, this isn't always possible, so it's just something to consider when you're shopping around for your data. Next, it's important that the so-called disadvantaged or the least advantaged, the most vulnerable or disadvantaged population groups are identified through consultation with communities and decision makers. And then also just a final note there that the frameworks that I reviewed were really in reference to the general population, and they don't necessarily capture the characteristics of all population groups. So for example, we know that the Aboriginal population will have unique indicators for cultural well-being. There might be unique health and well-being indicators for children's health. So those were all beyond the scope of my project, but something that definitely would need to be considered in future. Strengths and challenges. First of all, for strengths, I thought it was really helpful, and I really appreciated that I was able to incorporate sort of the theoretical component and then the jurisdictional review. I think it added more breadth and depth and really just painted a more nuanced picture of community health and well-being indicators. And for an example, one of the projects I reviewed in Winnipeg had community gardens as an indicator of community health and well-being, and that just wasn't something that I saw in the academic literature, so that was really helpful. And then also including a variety of project approaches. So I mentioned sustainability before. Sustainability often has more of a time dimension to it, so they're concerned about the health of future generations and so on. And I just thought that was a really nice complement to population health. And then for challenges, this is mainly related to relying on the internet to find my jurisdictional projects. So I wouldn't have found projects that hadn't been online, and even if the information was there, it doesn't mean that it was really accurate or up to date, that kind of thing. So if I had more time in ethics approval, it would have been good to have had actual interviews or surveys or that kind of thing. Implications for public health. I was really struck by, when I was looking at the definitions for health and well-being, how much I felt like I'd come to our very first week when I think we spent an entire week talking about the definition of health and realizing it's something that we all think we know, but it's actually really complex. And so in the project, we use the definitions by the WHO for health. And actually, these definitions have a lot of, there's a lot of critiques with these definitions. Same with well-being. There's actually no consensus on how well-being is defined. And these things matter because how they're defined dictates how they're measured. So there's significant implications there. And I think that public health certainly has a role in that discussion. Second, how do we know that we're actually measuring the things that we're supposed to be measuring? So there's issues around indicator validity and reliability, socioeconomic status, for example. I remember a paper last year talking about all the different interpretations of SES. And so I think if we want to be sure we're really measuring the right thing, we need to get in the big guns and make sure that we are truly measuring the right things. And then third, pretty much all the literature that I came across really stressed the importance of community engagement to make sure that we're measuring things that matter to the communities we're trying to monitor. So that was noted too. And then finally, these projects really can be a force for good. You have these great intersectoral collaborations, doing great work with advocacy, education, awareness. They can be tools for policy making like they are in some places in Australia. They can hold governments accountable and improve transparency, so they really are a force for good. So just to sum up, these projects, as I said, can be a real tool for social change, but it's essential that evaluation is incorporated to understand what sort of impact they're having and why. But for any of this to be meaningful, the community should really be included if at all possible. And at the end of the day, you can only do your best since, as the saying goes, not everything that matters can be measured, and not everything that is measured matters. And I would just like to thank Maurice and Christine at the CRD, Marika and Rupert at the Community Social Planning Council, my classmate Shannon, APA Queen, and our wonderful instructors. Thank you very much.
Okay, before she runs away from the stage, yes, we have some questions.
Thanks, Ardeth. I'm Caroline Walter. It was a great presentation, really good enthusiasm. My question for you is, in terms of the definition, when you said that definition matters and you were talking about the definition of health, were you able to input some of your experience or some of the things you learned in this MPH program for the definition, or was it mostly set and that's how it went?
No, there was some input, but the work that had been done by the CRD before drew on those definitions, and so just to be consistent. But also, I mean, it's such a classic, like so many governments and agencies and everyone does the WHO definition. So, I mean, I think there could have been more, I did sort of discuss that, thanks to Kathy and Michael's input, I discussed that those definitions would frame the rest of the project and could maybe exclude other definitions. But yeah, I could have had input, but I thought, I kind of went with the flow. So yeah, thanks.
Awesome, thanks.
Anybody else? I see no other hands. All right, well, in that case, thank you very much, Ardeth.
Thank you.
And next up,